Is this visible?
Perfect, perfect.
I'm sorry for this. So, thank you so much, Dr. Namrata and for having me here. And it's great to be in this international conclave. And I'll be covering up the virtual perimetry. Uh, Virtual perimeters, they are actually they are the in thing, and the recent developments. Lots of recent developments have occurred in this field. There's a continuous evolution of portable visual field tests that are going on, and the emerging tablets, the computers, and the internet-based diagnostic procedures have come up. Many other approaches have also been introduced in this era, and the visual field test is dawning. And the virtual reality headsets, this is something which is a game changer when it comes to perimetry, for two reasons: that they have an ability to control the fixation, and the distance from the eye to the screen is fixed. Hence, there is no variability that comes up with the device in itself. And the virtual reality headsets, they also solve the fixation issues because they do have a gaze tracking system out there in them. So the virtual perimetry that is usually done these days comes up with the virtual reality headsets, although there is a lot of description in the peer-reviewed various devices. They have been used, like tablets, iPads, etc. They have been used currently. The availability of the portable devices, they are very expensive and battery operated devices. That can interface with the telemedicine programs. They should be tremendously beneficial for vision testing in the developing countries. And they have the ability to conduct these tests in a waiting room also. And therefore, this can be really beneficial. It can be cost effective, time saving also for the surgeons. So these are different kind of literatures that are there in the peer-reviewed in the peer review. Most of them are basically the subjective tests, wherein the patient has to click the button when you see the visual stimulus. And N-Goggle, which has been described, that's a portable brain-computer interface, and it detects the visual function through the electrical responses that come up in the visual cortex. So there is also the online perimetry tests which have been described, the Peristat, which was recently published last year. Coming up to something new that I would like to introduce is the Advanced Vision Analyzer. This is a newer device in the horizon, and by the Alizar Vision technology. I'd like to discuss on this because I have been using it for quite a while, and I have also been a part of coming up with the nomograms for this device. So this AVA is a virtual reality automated perimeter. You can see these are the basic four parts of this, the constituents, the head-mounted device. On the left, what you see is the patient response pattern. The test control device, it's a tablet, which you see on the right. And the fourth is the backend cloud server, which helps to store the data and transfer the data. And you can also retrieve it as and when you need it. So some of the key features that I would like to highlight about this newer virtual reality headset perimeter is that it offers white-on-white perimetry, and it has an eye tracking system, that helps to track for the movements. You can adjust the interpupillary distance, you can place the corrective lenses and correct the refractive error of the eyes that are being tested. The stimuli that is used in this is the standard Goldman size 3. And there are various catch trials that have been incorporated into the device, and they are conducted periodically after every 10 stimuli presentations. And the test strategy, it keeps on checking for the false, negative, positive, and the fixation losses. As I said before, it has a cloud-based storage system. So from where you can retrieve all the reports and the information, you can even transfer this data to any other surgeon. You want to take an opinion of other surgeons, or probably you want to email the data, you can just do it. And the data of all the reports, it can be easily accessed through the test control device, and it's stored on the cloud-based storage system. So I would just like to show this small clip about the newer virtual reality, what you see, device. This is the headset, which is mounted on the head, and this is the test control device. There is an adjustable headband that goes, and it helps to fixate it onto the head of the patient. The patient response pattern, the patient usually clicks when the patient sees the stimuli. The test control device helps you to feed the entire data of the patient, like the eye, which is going to be tested, the strategy, and the kind of threshold test that you want to do. You can even do a screening test with this. There is a gaze tracking system that you see here, and it accounts for all the fixation losses and the false positives and the false negatives, etc. So in this AVA, what we are offering right now is the 30-2, 24-2, and a 10-2 program with the algorithms. The ELISA Fast, we call this as an ELISA Fast. It's the screening test. It is similar to the Humphrey, for the CETA Fast that we do on a Humphrey field test. And there is an ELISA ZEST. The ZEST is the Zippy estimation of sequential threshold. It is one of the methods of how you do a threshold testing. This is similar to the CETA standard, and there is obviously a full threshold testing that can be done. The device, AVA has its own normative database. The parameters have been included are the age-corrected mean for all the test points. The probability limits have been set for total deviation for the mean defect and the and pattern standard deviation. The values for 5%, 2, 1, and 0.5% significance levels are being demonstrated. I will also show you the test report. How does it look like? The blind spot location tests have been done, and the location of the blind spot and the fixation losses cache trial method, they have been found to be very accurate in this AVA. Well, I'm not in a position to put the exact figures right now because it's into the peer literature, but it is real, it's into the peer review process. That's why I can't put up the data here, but it has been found to be very effective and very accurate. The retest variability tests have been done for the central, for the middle, and also for the peripheral visual fields, and the mean threshold values and standard deviations have also been calculated for that. And the linear regression analysis, it really shows that with the increase in eccentricity, there's a corresponding increase in the variability, and with the increase in sensitivity, there is a decrease in variability. This again is in sync with the previous test results that we have got with the standard perimetry devices like Humphrey. So this is how the visual field looks like. On the left, what you see is the AVA visual field by ELISA, and on the right, what you see is the Humphrey by the Zeiss. So you can see there's quite a similarity between the visual field reports. These are the field reports of the same patient that I'm trying to show you here. And the ongoing development for this device is about the progression analysis and the EMR integration. The advantages that we have with these devices that I just highlighted before was that the first thing is that it is portable. You can do it even in a supine position. If you have a patient with any neck deformity or a spine deformity, the patient need not sit all the time. You don't need a specific space to do this. It can be done even in the waiting room where the patient can perform this test. There's no learning curve. It's easier for the test administrator to do that. There is the accurate detection of visual field defects is there. It's very cost effective as compared to other standard automated perimeters that are in the market as of now. And it's definitely helpful in rural areas. You can screen your patients, you can send your reports to the doctor, to the ophthalmologist, or to the glaucoma specialist at a tertiary center or at a higher level, and you can get the reviews and the feedback, and you can treat your patients accordingly. It allows a lot of postural freedom, and especially for this in the post-COVID situation, when you have, the patient can even wear the mask, and the test administrator can stand at a considerable distance and still do the test. So these are certain advantages that come up with this. The suggested reading that I would like to say, if anybody's interested in reading about perimetry.
Yeah, mathematical character fixed.
So this is what I actually wanted to offer right now, because this is one of the latest advancements in this field of virtual perimetry. Thank you so much. I would like to address if anybody has any personal queries on my email ID. Thank you so much.
Thank you so much, Dr.